Yeah, office lines are still a thing. But with Vox Business Voice, they're clearer, cheaper, and more connected. Keep your team talking, cost low, and customers happy. From Operator Connect to Uncapped Business Voice, you'll talk your way to brand success. Speak to a specialist today. Vox, get connected. Visit us on www.vox.co.za.
The conversation turns to health and wellness, and it's a pleasure to dive back into the world of foot health today as we welcome back to studio podiatrist Calvin Sinnett. A reminder that he's a graduate of the University of Johannesburg who works with Cape Podiatry, who are foot care specialists with a number of branches in the Western Cape. And it's always great to have you with us, Calvin. Welcome.
Thank you so much for having us, Pippa. And we've brought Sean with, one of also the directors and partners at Cape Podiatry. But I think we do choose the worst Fridays to meet. The last Friday was absolutely cooking hot.
Now it's freezing cold and about to rain.
And rain a lot.
Okay, which has some implications for our foot health, believe it or not. And we're going to start there today. The last time you were with me, you were absolutely right. Boiling hot, we were talking about foot care in summertime. Today we're going to do it the other way around and talk about winter.
No, absolutely. And also Sean can put in when he feels fit.
Yeah. Nice to have you with us, Sean.
Pleasure.
Thanks.
And I think the most important thing, especially in the Western Cape, is how wet it gets.
Mm-hmm.
A lot of us commuting, walking, standing, especially CBD, you're definitely doing some sort of changing of offices and things like that. And the biggest concern is feet getting cold, feet getting wet, and not drying, managing, and look after them. That's the biggest thing.
And I mean, it seems like a silly thing to say, dry your feet, dry well between your toes. But what are the risks of not keeping your feet dry? Sean, do you want to talk to us a little bit about what could go wrong?
So accumulated liquid or moisture in the foot, specifically between the toes. Skin is what's called hygrophobic. In other words, it's going to absorb water.
Mm-hmm.
And if your foot is not being dried, you're going to absorb water in there. The skin will then get thick. And we've all sat in a bath and gotten out and said, I've got granny fingers.
Yes, and prunes on my toes. Yeah.
So you get, same thing will happen to your foot. Now the moisture stays in the foot gets wet. The skin can break down. It's a source of portal for infections. You can start getting infections. Bacteria love moist, warm, dark environments. So if we can take away the moist part, we're going to definitely possibly slow down the accumulation of bacteria and issues that can go on there. And then obviously also when feet are wet, they're going to get cold.
Mm-hmm.
And if feet are getting cold, then there's a whole lot of injuries that come with cold. The cold injuries, chilblains, Raynaud's phenomenon, things like that. And those can all be prevented if you just keep your foot dry.
Okay, so if you know it's a rainy day and you have to walk a certain distance, whether it's to get from the bus station to the office or even like we do from the parking lot into the office, what's the strategy? And Calvin, should you have a change of shoes with you?
I think that's a big thing. I mean, one colleague we work with, he commutes in and he has got a pair of shoes that he leaves at work that's dry.
Oh, that's
because
clever.
He says, you just don't know. And even just a change of socks. So it literally takes 2 minutes, change shoes or change socks. Also, it's going to do two things. It's going to keep the feet dry, keep the foot healthier, as well as also, like Sean was saying, keeping it warm. Warm is very, very important. Also, if you've got sort of other underlying conditions, making sure your feet are kept warm, kept safe, and actually to check that the shoe's fitting properly also makes a big difference. Also, if you've got more of a leather-based sort of shoe getting wet, it's going to stretch more, foot's going to move more in the shoe.
Oh.
So also shoe fit, and also it's cold. So how many ladies, gentlemen too, but a lot of ladies now will say, I'm wearing 2-3 pairs of socks. You say, sure, but yes, does it fit your shoe? Is it a bit too tight? Is it maybe pushing on that big toe that wasn't ingrowing, but now there's pressure? Now all of a sudden the big toe is now starting to get sore. So there's other factors that also go with the cold about wearing socks and how many pairs of socks, and very thick socks versus maybe 2 pairs of thinner socks. It's also important.
Which would you prefer as a podiatrist? Should somebody rather wear a single pair of thick socks or 2 layers of thin socks?
Yeah, my views are 2 layers of thin socks. Sean,
really?
I think agrees with us. Yeah.
Yeah, 2 layers of socks. And also if you're going back to the moist environment, if you've got a dry, thin sock on the foot and a thicker sock outside, and a lot of socks actually wick away moisture now. There's a lot of really good technology in the fibers that they're using on socks that takes moisture away from the foot. So the 2 socks often helps keep it warmer.
Okay.
So that's a hack that was actually, I learned that years ago back in the National Defence Force when I had to go to the army when we didn't have a choice. We used to wear a thin sock and then a thick sock, and it keeps your foot warmer.
I didn't know that. I'd always thought thick was the way to go, so I'm really glad you told us that. Okay.
Also, I think, Pippa, to add on to that, a lot of the kids going to school, obviously in a leather shoe, we drop them off and it's dark and fetch them, and it's been a long day. A lot of the kids I found recently, and maybe the last 2 weeks, are coming in also with trying to get away with work it out. And sometimes I'm saying, even a little secret sock
Yeah.
followed by a school sock. Keeps the toes warmer.
Okay, so the little secret invisible foot cover
Just
underneath
something,
the sock.
just to keep it warmer.
Okay, I'm learning a lot and taking lots of notes here today, and I hope listeners are too. I want to remind listeners, if you want to ask a question, you're very welcome to do so either by calling in on 021 446 0567 or sending a WhatsApp on 072 567 1567. Calvin Sinnett and Sean Pincus with us, both from Cape Podiatry. So this is your opportunity. Now, you were talking about how much bacteria love the warm, moist, dark environment, Sean. And our first question already in from Jay in Takai, who says, at the gym, whether I'm going for a swim or a shower, I always put on slip-slops because I'm worried about getting athlete's foot. But I've noticed that so few others do so. And he's just interested to hear podiatrist's view on that practice.
It is 100% correct. And it's not just for fungal infections or bacterial infections, but there's viral infections. So plantar warts are traditionally passed away in wet environments. So around swimming pools and communal showers and change rooms, and it's got nothing to do with the hygiene of the place.
Okay.
So the floor can be spotlessly clean. Somebody can have a wart on their foot, walk in front of you, you walk in their footsteps and you pick up the virus. So they will give it away generally the same way they got it. Mm-hmm. So plantar warts are another pain in the nether region because I hate treating them. Because whenever you treat a wart, you never make friends. At some point, it's going to hurt.
Yeah.
So what he's doing, using a slip-slop or even a cheap sandal that can get wet in the shower, walking around the change room, very, very good idea. And I wish everybody did it. It would make a big difference.
Okay, so Jay, you have the view. Yeah,
just to stop transmitting what you might have to somebody who hasn't got it yet.
And I think you made such an important point there. It's not about the hygiene of the place or your own. It's part of your own hygiene, really, to say,
correct.
I don't want to pass it on if I've got it, and I certainly don't want to acquire it if somebody else has left a trace on the floor. Even the most immaculately maintained spot, 30 seconds after the floor has been washed, if somebody walked across it bearing that virus on their foot, it could be there. So, Jay, keep doing it and maybe tell everybody else around you that they should be doing it too, and the podiatrist told you it was recommended. Our next question is in from Louis, who says, I've got the recurring sensation of having a piece of tape stuck underneath my small toe and the one next to it. It's absolutely infuriating because there is nothing there. Any advice? Any idea what that could be, Calvin?
So there's a couple of things that do come to mind. Obviously, it's always difficult to comment online, but a feeling of sticky tape stuck under your foot definitely tells us immediately that there's some form of neurological absence. You're still feeling, yet you're not feeling.
Okay.
But you don't know what you're not feeling because your brain doesn't know what it's feeling, if that makes sense.
Okay.
It's quite complicated, but it is very complicated. In that other area on the foot, there is a couple of nerves coming down there. There can be, the list of things that could be is long, and literally could be coming all the way from the back to something very simple at the area, and it needs to be checked out. Because if that could just be a red flag that there is something else going on. Place to start, they can obviously start with their general practitioners, podiatrists. Obviously, we would have a look and try and understand. We'll be looking from the foot up, saying, okay, what could be the cause of it? Let's get a diagnosis. Mm-hmm. Once you've got a diagnosis, most things are manageable. But get that diagnosis that's right first.
Okay, so worth looking into.
Very much so.
Thanks so much for that, Louis. Right, let's have a bit of a talk about when you're not wearing shoes at all. And, okay, it's winter, so probably not as much barefoot walking and running going on as there might be in summer. But Peter says, I'm 63 and I have never had a single issue with my feet. I go barefoot almost all of the time. Is there benefit in that? Is there possibly a direct link between the amount of time he spends with no shoes on and the fact that he's never had any issues?
Yeah. He's habitually unshod.
Mm-hmm.
Most people in urban environments are habitually shod. And there's a distinction.
Yeah.
He says he's been going around wearing no shoes for most of his life. So that's his normal.
Yeah.
For a lot of people who've been wearing shoes all the time, that is not their normal. So his feet have toughened up. He's gotten used to the sensation of having things. He can probably walk over terrain that you or I would flinch when we just look at it.
Mm.
You know, he would probably fail the Lego block test. He could walk across a Lego block and not even worry about it. Whereas the rest of us would be, we'd be in hospital from the pain. So for him, he's not the normal yardstick that we're going to be dealing with. And realistically, the foot is meant to be unshod. However, humans have been wearing shoes from as far back as 150,000 years ago. There's archaeological evidence that we started putting some form of rudimentary covering on the foot from 150,000 years ago. And that was actually work done by a colleague of ours, Bernard Zipfel, who did the archaeological test here in the Western Cape,
Yeah.
where he found the footprints that showed that there were shoes that old.
Sure.
So yes, the foot's not meant to have shoes, but if call it ancient man 150,000 years ago realized the need to protect your foot, maybe we should think that we should need to protect our foot too sometimes.
There was some wisdom in that thinking. Okay, but Peter, obviously, if you are used to it, you've developed the toughness of your feet that allow you to keep doing it, then
Go for it.
keep going, because that is, as you say, that's your version of normal.
Sorry, Pippa,
Yeah.
to just add one thing in coming to winter, just also thinking about the shoe story. I ask my patients, they come in, they say, I'm working from home, let's say, 3-4 days a week. I say, what do you wear at home? I wear slippers. Okay. How old are your slippers? Oh, that's an awkward moment then. Think about these slippers aren't built to last traditionally. They're not really thick and they're not really cushioned. And I don't know what you find, Sean, but I find that most people are out wearing their slippers and they're not realizing. And I do say to my patients, consider what you're putting on your foot and how old it is. And yeah, it might look pink and purple and beautiful still, but you might have actually collapsed it out.
Okay, so is the shoe actually supporting the foot that's going into it
giving
anymore?
comfort.
Okay.
Especially you got a lady stays at home, or generally a retired person who lives in slippers now because they can. They're doing 5,000 to 10,000 steps in a pair of slippers that might have been finished about 2 years ago.
Okay, and that weren't designed to take that kind of traffic. I hear you. Okay, so be mindful of that if you are lucky enough to be able to go to work in slippers because you're sitting at home in front of your computer screen. Be mindful of making sure the slippers are still in good nick. Just to recap for anybody who came in late to the conversation, our guests in studio today, Calvin Sinnett and Sean Pincus of Cape Podiatry, taking your foot care questions. Let's just circle back to that issue of keeping your shoes and keeping your feet warm in winter. Jackie writes in with an interesting comment. She says, as a poor kid, my mum used to make us wear old newspapers in our shoes under the socks. Is that recommended? Is it an effective insulation method?
Excellent. If you drive around Cape Town and you see homeless people sleeping, they're sleeping under cardboard or they're sleeping on cardboard, because paper is a very good insulator. And people who work in factories where they're sitting with their feet on a hard concrete floor, in winter they might put a piece of cardboard or a couple of boxes under their feet because it stops the cold coming through into their foot. So it does work. It's a very good insulator. Paper is a very good insulator. Tour de France, the cyclists, when they do big descents, will put paper under their jerseys.
Really?
To stop the wind hitting their chest. So paper is an excellent insulator. It's not a bad idea. If you suffer from really cold feet and you want to stop the temperature of the floor coming through the shoe into your foot, bit of paper, it actually does work.
Now we've just got to hope that the newspapers keep on publishing long enough for us to keep on using that trick.
Can't
They're becoming
download
harder and
that.
harder to find these days. Okay, thank you for that. Right, let's see. We've got Shirley writing in who would like an opinion on a hot and burning sensation along the top of her feet, particularly when wearing closed shoes and socks, even if they're really good quality mohair socks. Again, very hard to diagnose, obviously, without seeing a patient. But Calvin, what might cause that sort of sensation on the top of the feet?
There's a good couple billion people in this world. Everyone's got feet. Yet we've only got so many different lasts that are produced, to produce shoes. So very often shoes might actually not be fitting the foot correctly.
Okay.
And often, generalizing obviously because of it being a lady, ladies often have a lot more slip-on shoes, a lot more boots, and a little bit more wedged. There's a huge possibility that it's got nothing to do with the foot, but it might be that the shoe itself is possibly putting a bit of pressure on, just as the first thing that comes to mind. We do spend a lot of time in our practices actually relacing shoes to take pressure off specific areas, because they can compress nerves and it can compress veins and arteries. So all of a sudden what happens is certain patients maybe go run, for example, get a pins and needle for whatever reason, and we turn out, actually, hold on, your lace is just too tight or it's too narrow. So it's actually sometimes the shoe's right, either not for you, or your laces are just not right for you, which sounds silly. And that's where the mohair socks, and they're giving the cushion and giving the support and keeping the foot warm. But it could just be a pressure. And when we talk pressure, I mean, it's literally as simple as just touching your finger on your top of your arm, top of your hand, and watching the blood go out. It can be as little light as that. Yet you go take 5,000 steps in that shoe, and it's sore.
It's going to have an impact. Okay,
So
so think
multiple
about
reasons.
the lacing.
But yeah.
Do you want to add to
And
that,
then
Sean?
burning feet is there's a plethora of reasons for burning feet as well, and you would also want to exclude the obvious ones, which is diabetes, nerve issues, nerve conduction. So she does need to go start at somebody to go through a process of exclusion to find out what's causing her burning feet and how best to manage it, because it's not just one thing. Burning feet, it's a complex thing, and you've got to really spend time interrogating the patient, discussing it, looking at previous medical history, family histories. Is there something that's being missed? Vitamin B deficiencies, one of the things that can cause burning feet. Lots of things can cause burning feet. So she really does need a sound assessment and a chat with somebody and a workup to go through and see, why are my feet burning? And sometimes you can exhaust all the options and they've still got burning feet.
And you don't actually know.
And you don't know.
Sometimes you can relace your shoes, Calvin, and it's all sorted.
100%.
So it could be a mechanical issue, but it could also be
150,
underlying.
I think it was 154 causes of neuropathy. One being diabetes, one being medicine, and then it starts.
Calvin, every time we've spoken, you've mentioned diabetics need to be super careful, mindful, paying attention to what's happening on their feet, examining their feet regularly, looking for signs of any change. And Sean's just referenced it again in this context of burning feet. Won't you just remind us before we run out of time? Diabetic feet, I know, are the bread and butter of a practice like yours in many respects. It's such an important thing to take care of.
It's so important, actually, and the sad part is often it's not a bread and butter, because people, I've just got a little bit of diabetes or got a little bit of sugar. It doesn't affect me. But when it does affect you, it's too late. And it's just, like Sean was saying, it's just ticking the boxes, just making sure that every single day, it's a schlep. And if you can't get there, use a cell phone. You can't get your cell phone under your foot to have a look, use a family member. You just want to ensure that that little blister that wasn't there yesterday, that's there today, the little toe that's a little bit more red than it was the other day, just get it checked out. It's just the little things. And realistically, if you're looking at your feet, you're going to clean your feet. If you're going to clean your feet, you're going to maybe put a bit of moisturizing cream or some sort of something on it. And it's just that little bit of extra care that can really save you in the long run, literally.
Yeah, literally save your foot, save your leg, and more, save your life.
Well, that's it. If your foot starts to become problematic, I can promise you it's going to affect you as a person, and life expectancy is very, very quickly.
Okay.
Take it, Just jump in there. If you look at the statistics, and these are worldwide statistics, and it's studies that have been done numerous times around the world. Every 20 seconds around the world, somebody develops a diabetic foot ulcer.
Sure.
Every 2 seconds around the world, somebody dies from complications related to a diabetic foot ulcer.
Sure.
So looking after your feet if you're diabetic, we harp on it all the time. It's not just because we like to say it. It's because, as Calvin says, it's limb-saving and life-saving. So if you are a patient with diabetes, please get your feet checked regularly. We can't say it often enough or loud enough.
We're going to keep on saying it every time we talk to you. Okay. Thank you, as always, Calvin Sinnett, and lovely to have your fellow partner from Cape Podiatry, Sean Pincus, with us as well today.